Good afternoon to the respected delegates and all the participants and one and all present here. Myself SB Abita. Today I am here to present GreenSterz, a solar driven autoclave for medical sharp sterilization in rural healthcare. So let me go to the topic of presentation. So here my outline covers introduction, related work and the system I have proposed, the technical framework, key performance of our system, analysis of results we have taken, testing, evaluation, future scope of our paper and certain references we have taken down. So the introduction here comes from the background study that rural healthcare faces persistent challenges like inadequate infrastructure, unreliable electricity, poor shop waste management. So these shops include medical scissors, forceps, tongs that are used during a ICU operation theatre that are used versatile in the hospitals, especially in the rural healthcare, rural clinics like primary healthcare in India. These aren't just logistical hurdles, but they directly impact the safety and effectiveness of the medical care. Like, for example, without any consistent electricity, even the basic sterilization procedures becomes compromised, putting both patients and healthcare workers under risk. In response to all these pressing needs, we had developed an integrated solution designed to foster sustainability and improve the healthcare delivery. So, our approach combines reliable energy access, safe waste handling, and infrastructure improvements. By addressing these foundational gaps, we aim to empower healthcare providers and also uplift the quality of care for under-reserved populations. So basically in healthcare there are large volumes of sharp waste daily, including infectious, hazardous materials. Improper disposal poses serious risk to healthcare workers, the public and also for the environment. Current systems rely on manual tracking and centralized databases which are very prone to errors and also manipulation. So there is a clear need for transparent, secure and efficient waste management solutions. So database technologies offer tamper-proof records and also improve data security. Web applications integrated with IoT sensors enable real-life tracking and also the automation. So these adopting all these features are very less in rural and resource constrained settings. Sterilization suffers because of unreliable electricity affecting the patient safety. So we have proposed a solar powered autoclave. This will offer a sustainable and also an uninterrupted solution. So we are going to propose an integrated model combining the smart waste tracking and also solar sterilization for the rural healthcare. And this we have proposed from the gaps that we have done from the study of the related work. So our system uses solar energy to power sterilization in rural healthcare. So we have a monocrystalline panel, PV panel. So this captures the sunlight and feeds into the power supply. The power flows through the driver circuit, activates a relay that controls the two branches. One branch has an vaporizer producing steam for sterilization. So this steam enters a sealed vessel monitored by a pressure gauge to ensure the safety. The second branch connects an temperature sensor and also a display unit. This allows real-time monitoring of sterilization conditions, and the entire setup is operating in an off-grid. So this is ideal for areas with unreliable electricity and also reduces the infection risk in low research clinics like primary healthcare centers. So it offers a practical solution for safe rural healthcare delivery. And this proposed system in hospital, usually they generate medical waste daily, including sharps that require safe disposal. So this flowchart shows how waste moves from the hospital to the manufacturer through a structured process. Collectors collect waste from the hospitals and also update to the central waste database. So recyclers check the database and after checking the database they send a contract request to the collectors. Once approved, the collectors confirm and update their contract details. Recyclers process these waste and send the recycled material to the manufacturer. So each step is tracked to ensure transparency and also the accountability. The database plays a key role in preventing the data manipulation and also the compliance. So this will reduce the environmental risk and also will give a smarter medical waste management. So this is what the system we have proposed. So infection control and waste management are critical, but we couldn't neglect those. So solar powered sterilization will offer a reliable and also off grid solution. Meanwhile, hospitals generate hazardous shocks, they require secure disposal. So our system uses IoT sensors and web based database to track the waste in a real time. So collectors, recyclers and manufacturers, they interact through a digital contract and get updated. So this setup will demonstrate a smart sterilization and also monitoring system for rural healthcare. So this is the technical framework. So this is the result we have obtained. So in this we have an electronic control unit with the microcontrollers and sensors. So it includes a display module for real time feedback and a temperature monitoring. So this system will collect data from the sterilization process and ensure a precise control. On the right we have a cylindrical tank. So this tank acts as a sterilization vessel. A pressure gauge mounted on the top monitors the internal pressure during the steam generation. The electronics and the tank will provide an sterilization circuit. The software is designed to manage and streamline the medical sharp waste right from generation of hospital to the recycling, and it could also be reused by the manufacturers. So the interface will have a modular software for managing the medical waste workflow. Each module will have options, input plan, supplements. So the inputs capture the real time data from the collector, recyclers and hospital. The plan module will outline the waste handling protocols and logistics. Supplements will display the contract details, material tracking from the manufacturer. So this will ensure a structured data entry and also the easy validation. So we have done certain tests and we also evaluated from the nearby hospitals and also the recycling centers. So the workflow integration will is like the hospitals input waste data and sterilization logs are collected. So in the collectors we update the pickup and status details and confirm the delivery. Recyclers will access the waste availability and initiate the contracts. Manufacturers will receive the recycled material and confirm the usage. Administrators will oversee the system performance, compliance and also they will report. So by combining all these advanced technologies with the renewable energy, a green midsters will minimize the environmental impact and improve the healthcare delivery, will also give a global sustainability. So the future scope of our paper, since we have integrated the solutions, so this could be a comprehensive solution with IoT enabled sensors. They provide the real time data. So with this we can address that AI can also be integrated to predict any equipment failures and optimize the waste collection. And at the same time advanced sensors can validate the sterilization cycles for infection control. So we could also integrate this platform with national health portals to support the compliance and reporting. Training modules can also be incorporated to improve the safety practices to the personnel who are handling this. Environmental analytics will track the carbon savings and also the sustainability impact. Together, these innovations will make rural healthcare smarter, safer, and more resilient. So thank you. So these are all certain references we have referred to do our research work. And thank you. So thank you all for this presentation. Thank you.